the health issues related to human immunity, and we'll be looking at AIDS. So the human immunodeficiency virus, HIV, is a virus that attacks the human immune system. HIV infection causes acquired immunodeficiency syndrome, and that is what we know as the AIDS. AIDS. So an AIDS patient is easily infected by other diseases because of the progressive destruction of the individual's human immune system. And the HIV spreads in the lymphocyte. It's going to destroy the lymphocyte itself. So that means it is attacking the human immune system. So an individual infected with HIV, although HIV has been actively attacking the immune system, does not show any symptoms for the first few years. They remain asymptomatic. And the symptoms of the disease include chronic diarrhea and fungi infection, which are only visible after 8 or 10 years. And since the immune system of the individual is already weakened, the body can be easily infected by diseases. And finally, the immune system is paralyzed. It is no longer working and the patient will die from other infections. Now, this is a picture showing the HIV attacking the lymphocyte. So, HIV enters the body through the transfer of body fluids, such as the blood and the semen, or across the placenta. And the women infected with HIV can transfer the virus to the baby during pregnancy, birth, or breastfeeding. Okay, however, HIV infection in fetus and newborn baby can be avoided with proper medical treatment when the mother is pregnant or during birth. So individuals can be infected by HIV through, this is the modes of transmission. Number one is through unprotected sexual relations with an infected individual. Number two, it is through sharing of contaminated needles used to inject drugs or tattoo ink. And number three, it is also through HIV-infected blood transfusion. So apart from AIDS, there are actually other types of diseases and conditions that are related to the to the immune system. Now, for example, SLE, systemic lupus erythematosus. Okay, also some allergy, which is related to the human immunity. So we have come to the end of the chapter, and let's look back. We have gone through body defense, where we have the first, the second, and the third line of defense, where the first and the second line of defense is not specific, but the third line of defense is specific, which includes antibodies, which are produced by the lymphocytes, and also their memory cells production. Also, we have looked into the actions of the antibodies, okay, by means of neutralization, agglutination, precipitation, opsonization, and lysis. Also, we have gone through these two types of immunity: active, which is further divided into natural and artificial active immunity; also passive immunity, divided into artificial and also natural passive immunity. So the difference between these two is that in active immunity, our lymphocytes, our body will produce the antibodies and in response to the pathogen, the antigen. Whereas in passive immunity, our body does not produce its own antibodies. And that's it for this chapter, chapter 11, immunity in humans.